Post-surgical recommendations at the time of hospital discharge after a gynecological surgery have changed significantly in recent decades. Many years ago, a restriction of physical activity for several weeks was recommended. However, today the opposite is the case. This is based on many clinical studies who have shown that intraoperative abdominal pressure during physiological activities such as Valsalva maneuvers when defecating or getting out of bed increased the intra-abdominal pressure more than simple movements such as lifting heavy objects of up to 15 kilos, walking, climbing stairs, getting out of a chair or resting. Obviously, things that are not justified based on the evidence to restrict them after hospital discharge. The main fear we had for restriction of physical activity was to avoid complications, and especially complications of the surgical wounds because of increased intra-abdominal pressure, which is, of course, nowadays is not supported by the scientific evidence. Therefore, we allowed patients to progressively return to their daily activity at home right after discharge from the hospital, or even to go for a walk outside the home as long as their comfort or pain allows them. It is also the reason why lifting heavy objects of daily use is allowed and going up or downstairs. The return to work is related to the type of work the patient does. For those with an administrative type of jobs, there are no limitations at all depending on how the patients are feeling. While for those who occasionally lift things at home, there are no slight more restrictions, but this does not usually go beyond 20 or 30 days after the surgery. On the other hand, patients can shower without any type of restriction for the same moment of the hospital discharge because all the surgical wounds are covered by a waterproof cloth. This makes it not even necessary to treat the surgical wounds until the 7 to 10 days when those waterproof cloths can be removed and the wounds are left in the open air to heal. Although for bathing in swimming pools or the sea there are some restrictions until the surgical wounds are completely dry and healed, and this is around 20 to 30 days after the surgery. Concerning driving vehicles, patients can resume this activity if they did it previously, as soon as they feel confident with accessing the pedals. However, it is recommended that the first trip are short and accompanied until patients gain sufficient confidence to drive on your own. Regarding sexual activity, it should be restricted for at least 40 days for those women who had had their uterus removed. This is called hysterectomy, or who had received any type of vaginal surgery either at the cervix or at the vagina or vulva. This is to allow an adequate healing of these tissues. However, those other patients who did not undergo any type of the previously procedure mentioned can reassume a sexual activity as soon as they feel like it. To conclude, currently we give recommendation at the time of hospital discharge based on scientific evidence that, as you have seen, has changed significantly compared to several decades ago. We nowadays allow patients to return to the physical activity as soon as the discomfort or pain disappears, and progressive reinsertion into their daily activities and work in a faster, a safer way for each of them.